Have you ever paused to wonder if you're truly measuring your blood pressure the right way? High blood pressure, or hypertension, is sometimes called the silent killer for good reason. It can damage your heart and blood vessels over years, often without a single warning sign. That's why catching and managing it early is so critical, and it all starts with one simple act: measuring your blood pressure. But what if you're doing it wrong without realizing? Today, we'll dive deep into the 12 most common mistakes people make when checking their blood pressure. Simple slip-ups, easy to overlook, yet each one can distort your results, setting you up for either missed treatment or unnecessary medications, with profound consequences for your health. So whether you measure at home or in the clinic, listen closely. We're not just talking numbers here. We're talking about accuracy, prevention, and ultimately, protecting your life. Together, let's examine each mistake, understand their real impact, and most importantly, discover practical ways to avoid them so your readings are as reliable as possible. Blood pressure matters more than you think. It's a vital sign that reflects the state of your cardiovascular system. Inaccurate readings can lead to a host of problems: unnecessary anxiety, unwarranted prescriptions and side effects, missed serious diagnoses, or feeling falsely reassured when danger lurks beneath the surface. So as you track your numbers, it pays, literally and figuratively, to get them right. With that in mind, let's explore the 12 blood pressure mistakes you absolutely must avoid. Let's start with the most common: not resting before taking your measurement. Many people, eager to get on with their day, simply sit down and strap on their blood pressure cuff right away. But did you know that your body needs time to settle into a true resting state? If you've just walked up the stairs, returned from a brisk walk, or even moved around the house, your heart and blood vessels are still adjusting to the exertion. Studies show that skipping this rest period can inflate your blood pressure by up to 12 points, enough to push you from borderline to high in your doctor's eyes. 5 quiet minutes are all it takes for most people's hearts and vessels to calm down. I recall a patient who rushed into the clinic after jogging, worried by a reading in the 160s, dangerously high. But after a few deep breaths and a short rest, his numbers dropped back to normal. The lesson? Respect those 5 minutes. They're a small investment for an accurate reading and your peace of mind. Next, let's talk about a surprisingly overlooked detail: talking during measurement. It might feel like no big deal to answer a quick question or have a conversation while measuring blood pressure, but even a few words can make a difference. When you speak, your body responds. Your muscles tense and your blood vessels can constrict, nudging your reading up by as much as 7 points. People are often shocked. After all, our bodies react strongly to stimulus, even something as minor as speaking. I've witnessed this countless times. A patient chatting away while the machine runs, then reacting with surprise at a higher than expected result. Silence is truly golden here. Stay as still and quiet as possible, focusing on your breath to capture your most accurate reading. The third mistake is measuring on just one arm and then choosing the lower number, or not realizing you should compare both arms. Did you know that blood pressure can differ significantly between arms? While a small variation is normal, a consistent difference of more than 10 points should never be ignored. It could signal an underlying vascular issue, such as narrowed or blocked arteries. Always check both arms initially, then use the higher reading from then on. This practice avoids the risk of underestimating your true blood pressure. I remember a patient whose right arm readings were consistently much higher than his left's. Further investigations revealed a significant arterial narrowing, catching a potentially dangerous problem early. This simple check could save your life. The fourth error: crossing your legs during the measurement. It's second nature for many of us, crossing our legs while chatting, working, or even relaxing. But when it comes to measuring blood pressure, this innocent habit can increase your numbers by up to 15 points. When your legs are crossed, blood is squeezed up through your body, artificially increasing pressure in your arteries. It's a big difference for such a small movement. Always keep your feet flat on the floor with your knees side by side and arms atop a support at heart level to avoid any interference with your reading. Fifth on our list, Failing to support your arm at heart level. What does that mean? Imagine holding your arm up, muscle engaged, while the cuff inflates. It's uncomfortable, right? This tension increases your blood pressure reading by up to 7 points. The correct method is simple. Rest your arm on a table or support so that it is level with your heart, palm facing up, with no muscle tension. This way, the measurement reflects what's happening in your bloodstream, not the effect of your posture or muscle use. Mistake number 6 is sitting without back support. Have you ever sat in a chair with no back, or perched on the edge while measuring your blood pressure? An unsupported back tenses muscles throughout the body, especially in the abdomen and back, which can increase your reading by 11 points. A good practice is to sit all the way back in your chair, feet flat, back firmly supported. Think of posture as a silent partner in achieving accurate readings. Slouching or tension can quietly but dramatically distort the results. Now, let's discuss the importance of the right cuff size. Mistake number 7. Most people assume a blood pressure cuff is one size fits all, but nothing could be further from the truth. If you use a cuff that's too small for your arm, it will squeeze harder, driving your blood pressure up artificially, sometimes by 10 points or more. Conversely, a cuff that's too large won't squeeze tightly enough, giving you an unrealistically low reading. Always make sure your cuff wraps snugly around your upper arm, with enough room for just one fingertip under the band. This is especially critical for people with above or below average arm circumference, bodybuilders or petite individuals, for example. I recall many young adults in my practice, athletic and lean, getting unnecessarily medicated simply because the wrong cuff size was used. A preventable mistake. 8th, drinking caffeine before checking your blood pressure. Coffee, tea, and caffeinated energy drinks are daily staples for many, but consuming them within 30 minutes of a reading can inflate your pressure by 10 points or more. Some people are especially sensitive to caffeine, feeling a spike within minutes that persists for an hour or longer. For the most accurate measurement, steer clear of caffeine for at least 30 minutes beforehand. Opt for decaf or herbal alternatives if necessary. If you want to know how caffeine affects you specifically, try measuring your blood pressure before and after your regular drink, and discuss the result with your healthcare provider. The 9th mistake is measuring with a full bladder. Bodily functions play a silent role in our vital signs. A bladder full of urine puts pressure on your lower abdomen and can raise your blood pressure by as much as 15 points. It's a hidden but common cause of false readings. Before you sit down to take your blood pressure, always make a quick trip to the bathroom. It's a small step that makes a world of difference in accuracy. Mistake number 10 concerns white coat hypertension and its cousin, masked hypertension. Many people notice they have higher readings at the doctor's office, but normal ones at home, a phenomenon known as white coat hypertension. It happens because the clinical environment, seeing healthcare staff, or being anxious, can all raise your blood pressure by triggering stress hormones. But there's a flip side, masked hypertension, where your readings are normal in the clinic, but elevated at home. Both scenarios can lead to misdiagnosis or missed treatment. The best approach is to measure blood pressure at home regularly when you're relaxed, then share the data with your healthcare provider. This creates a more complete picture of your true cardiovascular risk and avoids knee-jerk reactions to a single abnormal reading. Next, mistake 11, inconsistent monitoring. One single measurement is almost never enough to make a correct diagnosis or treatment adjustment. Blood pressure fluctuates throughout the day, affected by mood, physical activity, meals, and hundreds of other factors. Medical professionals recommend measuring your blood pressure at least 3 times per day for 7 consecutive days, then averaging the results for a true baseline. This removes random blips and gives your doctor real data to work with. If you only check when you remember, or worse, only when you feel off, you might miss trends that are critical for your long-term health. Finally, mistake 12, neglected device calibration. Unfortunately, it's not just about your technique. Even if you do everything else right, an improperly calibrated blood pressure monitor can produce consistently misleading results. Over time, the internal mechanisms in your monitor can drift out of alignment, especially with frequent use. Experts advise calibrating your device at least once a year. Some pharmacies and clinics offer this service. Ask your healthcare provider how and where you can get it done. If your readings ever dramatically shift or just don't match what you're getting at the clinic, calibration should be your first checkpoint. Many patients in my practice, when baffled by unexpected spikes or dips, found that recalibrating their monitor revealed the culprit and restored their peace of mind. Now that we've explored the 12 most common blood pressure mistakes, let's pause for a moment and reflect on the stakes. Each of these errors can add several points to your reading. Combined, even just a few wrong steps can tip you from a safe, normal reading into dangerous territory. Conversely, they can make a high reading look reassuringly low. The real risk isn't just the number on the screen, it's the cascade of decisions that number triggers. An artificially high reading may prompt a prescription for medication you don't need, with possible side effects. An artificially low reading could leave you untreated and vulnerable to the progressive damage of unchecked hypertension, heart attacks, strokes, kidney disease, or blindness, all lying in wait, silent and unannounced. The simple act of measuring your blood pressure correctly becomes a cornerstone of good health. It's about empowering yourself. When you measure accurately, you and your healthcare team can make informed decisions, taking targeted action that genuinely protects your heart, brain, and arteries. Let's take a practical walkthrough, step by step, to create an accurate, trustworthy routine each time you check your blood pressure. First, give yourself time. Set aside at least 5 minutes to rest quietly. Turn off any distractions. No TV, no phone conversations, no work emails. Use this moment for yourself. Next, use the restroom if you need to. Make sure your bladder is empty, so no internal tension can skew your readings. Choose the right spot for your measurement. Sit in a comfortable chair with your back firmly supported. Keep your feet flat on the ground. No crossing or dangling. Roll up your sleeve and select the correct cuff size. If you're unsure, compare your cuff to your pharmacy's or clinic's standard. Slide the cuff up so that its lower edge is about an inch above your elbow crease. The tubing should run along the inside of your arm, aligned with your brachial artery, which passes just inside the crease. Rest your arm on a table or armrest so that your elbow is roughly at the same height as your heart. Your palm should face upward, loosely relaxed. Remain silent and still. Don't talk, sing, scroll on your phone, or move your arm while the device inflates and records your blood pressure. Take the first reading. Wait a minute. Then take a second reading. If the two results are far apart, take a third. If you're monitoring at home, track your numbers in a notebook, app, or dedicated blood pressure log, noting the date, time, and any circumstances that could influence them. Caffeine use, stress, illness, or physical activity. Repeat this process for each arm at least once in the beginning. If readings are similar, either arm can be used for future measurements. If there's a consistent difference of 10 points or more, always use the arm with the higher value. Remember, measuring at the same time each day can help reveal patterns and minimize day-to-day variability. Mornings before breakfast or medications and evenings before bed are commonly recommended times. Every year, or sooner if you notice odd results, have your device calibrated at a pharmacy, hospital, or by your healthcare provider. This ensures your home monitor remains accurate and dependable. By building this routine, you remove chance and guesswork. Over time, you'll notice how stress, lack of sleep, certain foods, or exercise affect your readings, allowing you to make proactive changes to your lifestyle. Let's take a step back and reflect on the profound importance of these steps. Hypertension is the leading cause of heart disease and stroke around the world. Yet, with reliable blood pressure data, the path to health becomes visible. A map guiding you to diet adjustments, exercise routines, medication decisions, or, in fortunate cases, healthy habits instead of prescriptions. Accurate measurement allows doctors to distinguish between white coat effects and true danger. For example, imagine two patients. The first has high readings only at the doctor's office, white coat hypertension. Without home data, the risk exists for overtreatment, unnecessary expense, and side effects. The second has normal clinics readings, but with diligent home monitoring, discovers they're actually elevated every evening after work. masked hypertension. By catching this early, treatment and lifestyle changes prevent years of silent arterial damage. Your own readings become a tool of self-awareness. They reveal the hidden effects of everyday choices: too much salt, a stressful week, poor sleep, or the benefits of a healthy walk. When you learn what influences your numbers, you gain agency over your heart health, shaping your tomorrow with each decision. Blood pressure measurement is just one small part of the bigger heart health picture, but it's the starting line for your journey. If you've made any of these mistakes in the past, don't worry. Now you know, and you have the tools to do better. Each correct measurement brings you closer to a healthier life, freeing you from fear and uncertainty. So the next time you prepare to measure your blood pressure, remember, take your time, stay quiet, check both arms, use proper posture, choose the right cuff, avoid caffeine and a full bladder. Be consistent and keep your device calibrated. In this small daily act, you hold a powerful shield against the silent threats to your health. If you found these insights helpful, don't hesitate to take action. Share this information with your loved ones, parents, grandparents, friends, anyone who monitors their blood pressure. You'd be surprised how many people, even those who've done it for years, are making one or more of these common mistakes. By spreading the word, you multiply the protective power of these simple steps many times over. And if you're just starting out on your heart health journey, I encourage you to carry these lessons forward. Invest in a reliable monitor, learn the correct technique, and track your results. Over time, you'll gain confidence and expertise, turning this daily task into a routine as automatic as brushing your teeth. Finally, let's address a few frequently asked questions to clarify any lingering uncertainties about measuring blood pressure at home. Some people wonder, should I measure before or after taking my blood pressure medicine? For the most accurate assessment of your baseline blood pressure, it's often best to measure before taking your medications and at the same time each day, such as first thing in the morning and right before dinner. However, your healthcare provider may tailor this guidance based on your individual situation. Is it normal for my blood pressure to fluctuate throughout the day? Absolutely. Blood pressure is dynamic, responding to stress, meals, sleep, posture, and physical activity. While large swings should be discussed with your doctor, small daily variations are completely normal. What if my reading is unusually high or low one day? Don't panic over one odd result. Ensure you followed all the steps we discussed, then re-measure after a few minutes of rest. If the high reading persists, contact your healthcare provider, especially if you're experiencing symptoms like headache, chest pain, or dizziness. How long should I wait between readings? Wait at least 1 to 2 minutes between consecutive readings. This allows your blood vessels to return to their natural state, ensuring each measurement reflects your true baseline. Do smartwatches or finger monitors give accurate blood pressure readings? While technology is improving, upper arm monitors remain the gold standard, validated for clinical accuracy. Wrist and finger devices may be less reliable, often due to improper positioning. If you use one of these, be sure to strictly follow manufacturer instructions or use them as supplemental tools rather than replacements for an arm cuff. As you move forward, remember, accurate blood pressure measurement is within everyone's reach. By avoiding these 12 mistakes and building a better routine, you safeguard your health for years to come. Taking care of your heart starts with knowing your numbers and knowing they're right. Thank you for tuning in. Your health journey is about the small steps repeated daily, and these tips are just the beginning. If you gained value from this information, help others find it too by liking, sharing, and subscribing. Stay informed, stay proactive, and I'll be back soon with more practical insights to help you thrive. Until next time, remember, a healthier heart beats with knowledge, attention, and care. Make every reading count.